Staying in Europe, the European crisis in Greece has left thousands of people with no access to public health care. But the hardship also has bonded Greeks together. And many, in a show of solidarity, have created volunteer medical centers. Filio Kontrafouri has visited one such clinic in Athens and sent us this report.
This boy is yet another young Greek with no access to public health care. And here is the only place where his family can turn for medical care. The Metropolitan Community Clinic, tucked inside a former U.S. military base at the suburb of Elliniko. People from all over the country come here. It only provides services to those who are unemployed, uninsured, or poor, and it's free.
The mission of this medical center is based on volunteerism and on people's will to serve their fellow citizens. Our motto is, no one is alone during the crisis.
The clinic relies solely on donations of medicine and medical supplies and on the hard work of its over 100 volunteers. The municipality pays the utility bills. Doctors here estimate that right now at least 40% of Greeks are either uninsured or cannot get public health care, and the trend is likely to grow.
With the new measures, they say that those insured will pay a bigger participation for medicine, for hospitalization, and you can understand that with the cuts in salaries and pensions, even those insured won't be able to pay for an exam or get hospitalized. So I'm afraid that the humanitarian crisis we already witness among those uninsured will become tremendous because it will affect almost every Greek.
When the clinic first opened less than a year ago, it cared for about 5 people a day. Now, close to 50 line up on a daily basis, from pregnant women and malnourished children to those requiring emergency care.
A woman needing to urgently go to the hospital is now inside with a colleague, a cardiologist. She is uninsured, poor, she has a serious heart problem, she has suffered a stroke, she has high blood pressure. No hospital is admitting her unless she pays.
Greece's overall public healthcare system is on the verge of collapse. Public hospitals are understaffed and undersupplied. The government owes millions of euros to pharmacies and medical staff, and doctors walk off the job every week to protest further cuts in salaries and hospital budgets expected to exceed well over 1 billion euros.
The new spending cuts will create even further problems in the public healthcare system. And that means that even more Greeks will depend on volunteer medical centers like this one to get the healthcare they need. Filio Kontrafouri, CCTV, Athens.